Welcome back to the next episode of the Pathology Report. We're at the Pathology Update 2025 in Melbourne, and it's my great pleasure to introduce three forensic pathologists. Now, I was just thinking, I don't know what a collection of forensic pathologists is, but we might discover that as we go through. So I'd like
call it a body.
A body of forensic pathologists. Well, there you go. I would like to first introduce Jack, and perhaps Jack, if you tell us your background and yeah.
I'm Jack Garland. I'm a forensic pathologist, quite early in my career, but with quite a long history of being involved in research, particularly interested in postmortem biochemistry, but dabble in a lot of different areas, depending on what takes my intrigue at the time.
Cool. And Steve?
So my name's Steve Wills. I'm originally from the UK. I trained first as a dentist, so I came to medicine and forensic pathology quite late in the day. I now work in Adelaide.
Cool. And Hans?
Yeah, I'm Hans De Boer. I'm also a forensic pathologist, originally from the Netherlands. I've been in Australia now for 4 years, I believe, yeah. And before that, yeah, I was a forensic pathologist for 3 years already in the Netherlands. And yeah, I work in Melbourne, and like Jack, I love research, but only do what I find interesting.
Best research.
Yeah.
And look, what we're talking about today is evidence in pathology, and obviously, in your line of work, evidence is you're collecting evidence, you find, and it's key to what you do. I understand, day in, day out. So, Jack, what are the differences between evidence and opinion?
So the evidence is the information that can be used to inform your opinion, and ideally, different amounts of evidence when you're deciding your opinion will contribute to different extents to that opinion. So some evidence will be stronger or lesser when you're forming that opinion. So the opinion is the culmination of that information, which may differ depending on the context of which you're being asked. Different evidence may carry a different influence on your end opinion based on what kind of questions you're being asked or what different possibilities you're being asked to differentiate between.
Yeah. And look, I imagine that most of the people who are watching and listening today, their experience of forensic pathology would be in the TV shows that we watch. Is that pretty representative of what it's like presenting or giving opinions based on evidence?
I don't wear sunglasses in court, but I think there's a lot fewer immediate conclusions in real life than on the TV shows. Things aren't normally solved before you've even left the scene, at least not from a forensic pathologist perspective. And I would like to think that our degree of confidence in those opinions is not as certain as you see on television, where people have unequivocally reached a singular diagnosis to the exclusion of all others.
Yeah, I think if you talk indeed about the TV shows where people are definitely certain and we are much more uncertain, and I think that has to do with that difference between evidence and opinions. I think the evidence is the objective fact that you have, the pathology finding, the autopsy finding, but also the scientific literature as it exists. But there's always the peculiarities of the case, the specifics of the case. So you always have to interpret it to that particular case. And that's when it becomes an opinion, because that has to do with your own training, your own experience, how you weigh this evidence. And that's why, indeed, forensic pathology evidence, as given in court, is most of the time an opinion.
Yeah.
It is not something the same across the board. It is what that particular pathologist believes based on his findings and the scientific body, the body of knowledge.
Now, I heard a term, empirical evidence. What's that?
So empirical evidence is evidence that is based on observations and sometimes on testing. So if you've done studies where you're looking at outcomes given certain interventions or certain testable findings that are ideally repeatable across different occasions and between practitioners, that is an example of empirical evidence where what you observe is then being put into practice as part of forming that opinion later on, but that type of evidence is something that has been measured or quantified or otherwise observed.
Yeah, it's an observation, right?
Yeah.
Yeah, that's cool.
And look, I might just go to Steve and ask you about what makes evidence robust so it's going to stand up to scrutiny?
Yeah, I think our court is evidence, the evidence base upon which we give our opinion, and then there's the evidence that we give in court. I suppose our ultimate role is to give robust evidence in the legal system, and obviously the evidence base for what we do is strong in some areas, but it's significantly lacking in other areas. I think, from a medico-legal perspective, for our evidence to be robust in court, you have to at least make it open that the scientific evidential basis for your opinion is made clear, that because it's not the pathologist's job to make the decision whether the person is guilty or not. The court makes the decision based upon the evidence that we give. So it's incumbent upon us to give our evidence in court is robust in that it's open, that it's honest, and that the court can test the validity of our opinion to do its duty. And it's just to explain, I guess, the robustness of our evidence base for the opinion that we're giving, and then that ensures us we're given a robust opinion fulfills our duty to the legal system, by explaining to them, well, this is my opinion, this is the strength of the scientific evidence that is based upon, therefore they can do their duty and hopefully get the correct outcome.
Yeah, I think if you talk about robustness, it is not the same as confidence. I think robust means that it holds up to scrutiny, and that you think that another pathologist with the same set of information would come to the same conclusion, that it is an agreed upon position that you make. I think that is robustness. Also open to peer review, open to cross-examination, that's robust. But you can very robustly say, I do not know. And I think that's a very important difference, that in our line of work, you have to have 20, 30 types of ways up your sleeve to say, I don't know, because that's something you will be saying a lot in court. But that can be a very robust position. Every forensic pathologist in that position will say the same thing. Because you have the evidence that you can't say. Because you have the evidence that there is no evidence. So I think that's a very important difference between indeed scientifically robust and whether you can help the court or whether you can say something helpful. That is actually not important for us.
We think our job is to guide the court as to what the scientific validity of the opinion is and how strong or weak it is based upon the fundamental science. And that's our duty as an expert witness. It's not necessarily to come up with a firm answer to every single question, although giving evidence in court, people like you to do that. And he said about the media, obviously it's portrayed that you can give the absolute correct answer to every possible question. I mean, time of death being an absolute classic one. The pathologist rocks up to the scene, doesn't even take a temperature and pronounces the time of death, when in fact in ideal circumstances it's so inaccurate as to be almost useless. The actuality of it. And I've been called back into court, but the jury has passed a note to the judge, would the pathologist come back in and talk about time of death? Because the jury expect from the media that that's what the pathologist does.
That's my expectation.
So
you say
I guess,
it can't.
So our duty is to deliver robust evidence in court is to actually tell them that the evidence basis for time of death determination is anything but robust.
Exactly. There's very robust evidence. But it's unwise to give them.
But it's a good example of where as you said, there's difference between robustness and the confidence in which something can be delivered. Because historically there was a nomogram that was basically this kind of mathematical formulae for calculating time since death. And it looks astonishingly impressive to a jury because it accounts for the body weight, it accounts for the temperature, it accounts for the weather, the estimated time. Therefore, is dependent on all these other mathematical factors, and it gives you an upper and lower limit range. It looks very impressive and scientific. And that's the danger of it, because actually it's completely unvalidated and in fact doesn't stand up to scientific scrutiny, despite the confidences upon which some cases of previous legal errors have occurred on that basis.
Now, just thinking about being a forensic pathologist and being in court, at what stage of career did you first front up in court? I presume that didn't happen when you were a registrar, or did it? Or when, you know, and what's the training for giving evidence? Or you know,
that's a really good question, because being trained in the Netherlands, I worked in a forensic institute, so we only did homicides, and I was trained on a specialist expert evidence course, all those things, because we were only doing homicides. Here, actually, it's not a formal part of your training, and that's
here in Australia.
That's here exactly. That's here in Australia, and I think that is so. You learn this from your peers, from your mentor in your department. You have to have cases that go to court. You have to be lucky with that. You have to be lucky that it's a particular case, indeed, that goes to courts. The type of case, of course, matters. So training is not so. I would say it could be done better in Australia, and we're actually looking into that within the RCPA now to do that better. So but to answer your question, you can go to court as a registrar if you feel confident, and your consultant also feels confident that you can do that. But you can also not end up in court until a couple of years after your consultees.
It can be at the discretion of the people subpoenaing you too.
Yes.
So, as many the person who has gone on extended holiday has found to their chagrin, is that they will not always accept a replacement pathologist who's reviewed the case in your stead. You've got to request who they wish, and that can include the registrar instead of the pathologist supervisor case.
Right. So that means coming back from your leave or whatever.
Or delaying leave, or in one occasion that I'm aware of, being asked to show up to a courtroom in Scotland and give evidence from there.
Really? Oh.
Yeah, and if you get a subpoena, you've got no choice, and
legal obligation.
You can negotiate with the instructing party, but you kind of got no choice. I mean, from my point of view, a trend in the UK. There's possibly more opportunities to give evidence in inquest in the UK, probably because there were more inquests. So some sort of coroners look reasonably kindly on medical training and would call the registrar to an inquest, possibly a less controversial one, just to give them some practice in court for real. Coroner's court is slightly different to criminal court. It's inquisitorial rather than adversarial. And we did a sort of expert witness training course was a requirement to get on the Home Office list of forensic pathologists. So that was a week-long course, culminating in a kind of mock trial with real barristers, and we're trying to work on something at the moment with some of our counsel assisting the coroner in South Australia for the trainees. So yeah, but actually the first time in a criminal trial was my first year as a consultant. Yeah.
It's interesting. I don't know whether it's the same opinion held by yourselves, though, but I think a lot of the emphasis in training for presenting evidence in court, from a forensic pathologist perspective, at least from my experience in training, is how to give your evidence in such a way that it doesn't embarrass you or undermine what you have to say. The informing the jury correctly and the other legal obligations are important, but they're almost secondary to the avoiding professional embarrassment emphasis.
It's like a public viva. It feels like that sometimes.
Yeah, and there's all these rules, as a forensic pathologist, you're out of your comfort zone. You come into this other world. Yeah. It's their playground. You have there's rules and regulations, how you behave, which questions you can answer, where do you look, and all this adds to nervousness, especially when you're somewhat younger. And it's suboptimal if you haven't trained that a bit, Indeed, in mock scenarios and had a few settings where you could just.
No mock scenario can prepare you for the real thing and the kind of the nerves you experience.
It helps.
It helps. And it probably also helps having seen, gone into the public gallery and watched some evidence. Even if it's not pathology evidence, you know what the kind of the way the court works and the way the judges and the lawyers address each other. How the jury works, and it's actually a lot of trials are quite stop and start. Short periods, and then a legal matter will come up, and sometimes the jury go out, sometimes they throw you out, and there's a lot of the time you can wake up in the morning and not know if you're going to give evidence that day. You'll have been warned for a period of time, but actually when you get into court is a massively movable feast as well, which as a doctor who's got other things to do, that can sometimes be quite challenging. But the courts take precedence.
And look, this discussion leads neatly into the next thing I wanted to inquire about, and that was how significant is one's experience when presenting pathology evidence in court, or for publication. But let's go with court.
Yeah, let's start. I mean, court is thinking. There's already a lot to this question because first of all, there's your experience as a forensic pathologist. So, how good are you in your job? How much experience do you have with this type of cases? Yeah. So indeed, and that leads into how robust is your evidence? How well are you acquainted with the issues in such a particular case? I mean, stabbing cases lead to very different questions than shooting cases or infant deaths. So experience informs your practice and helps you with those nerves. I think also from the other side, the more experienced pathologist, and this should not be the case, but the more experienced pathologist tends to be believed easier. This is especially in the case in an adversarial system with juries.
Could I just cut in there?
Yeah.
If the juries are making the decision, how are they deciding that a forensic pathologist is more experienced or not? Might it not depend on how they present rather than their years of experience, or how?
So,
How many letters you have after?
Well, yeah.
no, this is true, but the moment all court appearances I've done here, they first go through your CV.
Right.
So they know
exactly
who you are, what your credentials are, how long have you been in practice. But you're right. But there is something about a older, seasoned forensic pathologist that knows how to use words, that has seen it all before, has this aura of knowing it all. And then there's the young consultant who might actually be more right, might have more robust evidence, but struggles a bit, stammers a bit, is more uncomfortable. And this is a thing. This does happen, and so experience is important in the degree in which you are believed, but it also has to do with indeed how robust your evidence actually is. Experience is one of the most important sources of knowledge for forensic pathologists, but it can also be a source of great bias. You can make the same mistake for 40 years in a row and never be correct.
I think one advantage of experience, it gives some kind of insight into what questions may be asked in certain types of cases. Courts love timing, they love force, they love number of blows, and so some of the questions you get asked in a stabbing case would be recurring many cases of that type, and so that helps to a degree of you can predict the gist of a lot of the questions some of the time. The converse of that is occasionally you've got a question you have no idea why it's being asked. It doesn't even pertain to the actual cause of death. It may pertain to a single injury, and there may well have been an issue in the case that you know nothing about, where that, let's say, did the deceased person punch my client beforehand? So it's therefore they acted in self-defense, and so the whole thing can revolve around a tiny bruise on the knuckle.
And that touches on actually some of Hans' research, which he could speak to better than I could. But in terms of the types of questions you're being asked, you can't tell the jury or the court that you're being asked the wrong question. But when they're asking you a question about degree of force, for example, what they're actually tiptoeing around is, was this an intentional assault versus an accident? And they're not asking you the question that they're asking. It's quite different.
The words that are used as to what...
Exactly, and also almost preempting what your evidence will be used for, because indeed, actually, degree of force questions, which they always ask, it actually is about intent. They can't ask it, because that's the ultimate issue. That's what the jury needs to decide, the intent. But they want you, as forensic pathologists, to comment on it, to say, no, this is absolutely something you would not... This is substantial force. It's a meaningless statement, but they want you to say it, because then later on, when you're out of the courtroom, they can use that, the forensic pathologist said that this was substantial, so therefore he really needed to die. That's how you're going to be paraphrased.
It's the limitation to some of the questions you get asked in the courtroom is you don't know what's been done, as you say, before or afterwards. And certainly I've been in the court when a colleague of mine's given evidence, and I've stayed in the court afterwards, and we've had a discussion after the trial's come and gone, and kind of said, I wish that they'd asked you this, because that really would have helped explain something that they didn't seem to go down that avenue for, and I'm not sure that they got the right message for what your understanding of your evidence was.
Yeah, 'cause you can only answer the questions that are asked, of which you probably don't know the majority of them in the first instance, and yeah, you have no control over what you're asked, and that's the it's you've got to your duty is to convey your opinion and the weight of your opinion to the jury, but with the constraints of the court system, which is you can only answer the questions that you're asked by opposing sides who have different,
Very strategic.
the different and kind of.
The moment you want to explain the limitations of your opinion, they'll stop you. Say, sorry, doctor, that's a no. Thank you.
So, as a forensic pathologist and you're in court, you will be talking about the evidence that of which you're responsible. Like if it's a post-mortem, that's, you can talk to the evidence of the post-mortem. Might you be asked about evidence not related to the post-mortem, to something else, unrelated to what you're bringing to the table? Does that make sense?
So,
Like,
as an expert evidence, I mean, as an expert witness, you are bound by the fact. I mean, you have a special status as an expert witness. Normal witnesses can only give evidence about what they've actually seen. As an expert witness, you can also talk about your specialty and how it informs the case. So you have a special status. That, however, means that you can only comment on stuff that is within your area of expertise. The moment you stray outside of your area of expertise, you're no longer an expert witness. So therefore, you can't give that evidence. So this really revolves around what do you feel your area of expertise is. For instance, we use toxicology results in our reports and to formulate a cause of death. But I'm not a toxicologist. But I need to have a basic understanding of toxicology to be able to give those opinions. However, if it becomes really complex, I will refer to a toxicologist. So that is usually how you deal with that. You look at it, you're like, okay, is this forensic pathology? Do I think I have expertise in this? If not, then you suggest another expert witness. That can be a clinical doctor, it can be a toxicologist, it can be a microbiologist, whatever.
Yeah.
Start by saying what category of drug something is. It's within your area of expertise as a doctor. What does effect it have? Oh, it's a central nervous system depressant. But then that can start to evolve into somewhere where you're beyond the realm.
Could somebody have behaved like this with that level of drug? And, sort of, we can explain the limitations of interpretation of post-mortem toxicology, probably how it relates to death. But when you're getting into sort of what behaviour might somebody have exhibited, you're then straying out of your sort of core area of expertise. And there's clearly, they're asking those questions because they've got a vested interest in getting the answers that they want. It's also occasionally happens whereby you just get a completely random question about another medical, an alternative medical issue has come up in the case. I think, the pathologist, it's a doctor, he's coming in next, we'll ask him about it. And occasionally that'll happen. You just get a, can you explain this, doctor? And there's a reason for it, but you just don't know. And again, you just got to be a bit careful as to not letting yourself be dragged into areas that you're not comfortable with and are not within your area of expertise. And that's possibly something else that comes with a bit of experience. It's have to not let yourself be led too far into straying out of your area of sort of what you should be getting evidence in.
The urge to help can be quite yes, I'm sure. But you need to be firm and say, sorry, I don't know.
And you can, in fact, be asked the same question multiple times, phrased either the exact same way or other ways, and they can move along and then come back to it again. And it's, I assume, deliberately done to make you feel like you're being obstructive for giving the same answer that you cannot comment on that. But it's also easy to, I think, it's a difficult overlap sometimes when it comes to those where your realm of expertise finishes, because it's not uncommon in, for example, a traumatic death for there to be an extended hospital stay involving 3 or 4 different surgical and medical specialists leading up to a death following palliation in the intensive care unit. And you probably are the doctor that has the greatest understanding of the overall trajectory of that person during hospital, but you can't necessarily answer the individual questions around why certain interventions were or weren't done at a given time.
And that can be sometimes even more challenging in the inquest situation, when the issue is possibly, did something go wrong in a medical procedure, or was the correct medical procedure performed on this person? And clearly, that's an area that's not within our area of expertise. And again, you probably be careful not to be led down the garden path, really, and stick to your area of expertise. And I think like Hans was right. It says it's human nature to want to help.
That's right.
It can be difficult sometimes.
Well, look, thank you all. Thank you, body of forensic pathologists. Jack, Steve and Hans, it's been great to talk about all things evidence, and really interesting, and hopefully we'll be able to catch up again sometime soon. And thank you for your contributions to Pathology Update.
Thank you.
Thank you. Thank you. Thanks very much.